Alright, this is officially a review for your Med-Surg HESI, encompassing all the topics with Med-Surg, specifically on adult Med-Surg. Now, full disclosure, the topics on here aren't necessarily the only topics that are appearing on your HESI or the HESI in general. This more encompasses the most commonly tested topics. And the general idea of this review session is for you to give you an understanding of the classic / gold standard items in each one of these topics, but also for you to kind of do your own studying about this. But I will be going over what is the most commonly asked items about these topics in general. All right. So let's start off with ALS, right? We had a period in our time where we had the ALS challenge, right? So what was it? What was it to begin with? So it's a neurodegenerative. So when we talked about neurodegenerative, it's going to be chronic, it's going to be progressive, and it is not going to be reversible. There is no cure to it. So whenever we discuss topics that have no cure, we need to focus on symptomatic relief, right? We need to focus on the risk involved with this. So one specific risk is basically this is neurodegenerative. So what is your neural system for? Number one, movement, right? Number one, movement. Another name for this, by the way, is Lou Gehrig's disease, named after the famous baseball player which popularized this disease. So what happens? So basically the idea with ALS is over time, muscle weakness over time progresses in a state where complete paralysis is the total outcome. But the biggest problem is that this person is going to be fully aware intellectually and cognitively. So it's being trapped in a body that you have no control over. So what is our number one issue with that? Anytime we talk about neurodegenerative, number one is going to be safety. So safety, safety, safety. Anything you can choose on NCLEX or your HESI to answer about safety, pick that. So your gait, right? Number one is ambulation. Problems with ambulation, you're going to watch out for falls. Number two is breathing, right? Oxygenation. If they have a weak respiratory drive, we have to ventilate. And ultimately, another big weak point is your epiglottis, dysphagia. You have weak swallowing, you have problem swallowing, you're at risk for aspiration. So these are things you have to watch out for. These are the most common things you have to watch out for ALS. All right, let's talk aspirin. So the three big non-narcotic analgesics that we talk about, right? Tylenol, NSAIDs, aspirin. And number one is separate that into toxicities. Tylenol is toxic to your liver, or acetaminophen is toxic to your liver. Aspirin and NSAIDs toxic to your kidney. So you already know this is toxic to your kidney. Now, the name for aspirin is salicylate. That's a classification for it. But one thing you got to understand about aspirin as well is it can cause some toxicities for the body. And not just an analgesic, but also it's an antiplatelet. So you got to know what your platelet is for, right? Platelets for clotting. So if aspirin lowers your platelets, you are at risk for a bleed. Okay, now other things to note down with aspirin, right? Because it is an antiplatelet, look for signs and symptoms of bleeding. GI bleed, right? Petechiae, random bruising, right? Coffee ground emesis, those are your main signs, okay? All right, other things to watch out for in regards to aspirin, right? One thing that it is toxic to is what we call ototoxicity. That's your ears. So whenever we say ototoxicity, one thing that they hear is tinnitus. That is the ringing of the ears. So something to watch out for. Okay. All right, anemia. Okay, so let's jump into this next one because anemia is more of there's a lot of causes to it. So first off, what is causing that anemia? So a lot of things, right? What is anemia in the first place? It's low red blood cells. So what are things that could cause a low red blood cell? So let's talk about what your red blood cells for in the first place. So red blood cells delivers oxygen to the cells. Without oxygen, where our cells are weak, it doesn't have the energy to use, right? Because it has no oxygen. So how can we lose this red blood cells? Number one is just simply by bleeding out. No, it doesn't have to be a massive trauma where you got your head cut off, everything's just bursting out. No, it could be as simple as a GI bleed, simple as coffee ground emesis, right? We're just expelling this blood some way, somehow. Another thing is what increases our red blood cells, and that is what we call iron. Iron is essential for the production of red blood cells. We have low iron stores, we have low red blood cells. And where do we get iron? Food. Right? We get iron for food. We have good food sources of iron. So if we are lacking that source, we are prone to developing anemia. So here real quick, we do have red meats as your main source. Okay, so what do we do with iron supplements? Just remember, there's two supplementation that you have to remember with iron. Iron with vitamin C increases absorption. So you want to give it with vitamin C, like your orange juice, right? Iron with calcium decreases absorption. So what does that mean? You probably can't give it with milk, probably can't give it with antacids like Pepsid. So things to watch out for. And it stains your teeth. For those of you with kids that you've ever given liquid iron to, you can clearly see that. I give it to my toddler all the time. I give it through a straw. So they need to take it with a straw. They need to brush their teeth after. All right, next topic is angina or angina. Nice little way of saying chest pain. So when we talk chest pain, basically there's going to be two different types of chest pain you need to remember. There's a stable versus unstable. Obviously, by the name, unstable is going to be a lot worse. So I want you to sectionalize it in these two, right? Stable, right? Stable, there's something causing it, meaning stress, physical activity, exercise, something happened in your life. Unstable, meaning nothing is really causing it that you can see, right? Unstable means you are at rest, you suddenly have chest pain. Now, with stable, we can fix it, right? You stop the activity, it goes away. You give nitroglycerin, it goes away. Unstable, on the other hand, does not disappear with rest, does not get fixed with nitroglycerin. Now we have issues. So let's talk about the stable. So stable, right, happens when there's activity or exercise, goes away with either rest or nitroglycerin. Know how to give nitroglycerin. So how do we give it? 3 doses max. 5 minutes apart each, right? And in between, you're checking blood pressure and making sure blood pressure doesn't go down. Why? Nitroglycerin vasodilates, so more blood can pass through whatever plaque is blocking the way. But if you vasodilate, right, there's less pressure in those arterial walls. The less pressure, the more that blood pressure drops. So we can't give it if the blood pressure falls below certain policies. Most policies say less than 100 systolic or less than 90 systolic. So something to watch out for. Unstable, on the other hand, you've done all your you've done your rests, right? You've done your nitro. Of course, you're following your acronym MONA, morphine, oxygen, nitroglycerin, aspirin. And you can add a B on the very back of that because most hospitals, we give beta blockers now. None of those work. What is our next step? You want to take an EKG. That is your gold standard. Note down, whenever I say gold standard or classic symptom, those are key things that are specific to these topics. Gold standard, EKG, right? Or ECG, depending what it's called. But what are we going to see? We're going to see a STEMI, either an NSTEMI or a STEMI. What does STEMI mean? ST elevation, myocardial infarction. What does that mean? You're seeing it on this little PQRST wave that the ST is elevated, right? And STEMI, you have time. STEMI, a lot worse. And we'll dive into that further in future slides. But those are what you're watching out for. All right, let's talk asthma. All right. One of the most common childhood diseases, but also common in adults. But what is happening there? So let's keep it plain and simple. All right. You are breathing through a giant pipe right now. What happens in asthma? You are now breathing through a straw. Whenever you do that, right, we create a musical note because it's such a narrow pathway. What is that musical note called? It's called wheezing. Whenever we narrow down pathways, we are now breathing in a wheezing type of sound. That's your adventitious lung sound, right? So what else is happening? You're producing extra mucus because it is kind of a sometimes an allergic reaction is what we look at it as, right? So we're giving a couple of different medications for this, right? We're giving a couple of different medications. You have to know your rescue inhalers versus your long-term inhalers. And that's going to be separated into two classes. Your beta-2 agonists, which your most common one is your albuterol. Anything that ends with a ROL, that's going to be your beta-2 agonist. That's your rescue inhaler. And then your steroid, or ICS, inhaled corticosteroid. Now, in the time of an emergency, are you going to give a steroid? No, you're going to give that rescue inhaler, right? Your albuterol. So one thing you got to note is assess the patient, give the albuterol, and reassess. You want to note down the improvement as well. So things to know with your albuterol too, it does raise heart rate and causes anxiety and restlessness. Watch out for those classic symptoms, classic side effects right there. And then steroids, you see this child right here, if they are inhaling that steroid right there, what do we have to note down with steroid? Well, steroid causes a couple things, right? One of the things it causes is lowers the immunity in a certain area. What if a steroid lowers the immunity in your mouth? We can cause what's called yeast infections, candidiasis, thrush. So they want to rinse that mouth after, okay? All right, atelectasis. Atelectasis, plain and simple, you have your alveoli, those little grape sacs. Alveoli are meant to do two things. It's meant to expand and contract, release the air, and gas exchange happens there. Well, what if it doesn't do that? Eventually, it'll collapse. That's what we call atelectasis. Now, what causes atelectasis? Basically, just not using them. So what do we have to do for our patient? Well, the main things you have to do are make sure they use their lungs. So how do we do that? Turn, cough, deep breathe, incentive spirometer. Those are my classic standard pulmonary hygiene steps. Turn, cough, deep breathe, and then use their incentive spirometer, okay? So those are the things you gotta make sure they do. All right, aspiration, or just a nice little way of saying choking, right? It occurs when what happens, right? Food goes down the wrong pathway. It goes down the airway, or something, a foreign body goes down the airway. Now, the biggest thing you need to note down with aspiration is how to prevent aspiration. So that's going to be proper positioning, how to feed the patient with a stroke, which is feeding them on the good side versus the bad, feeding them on the strong side, right? Chin tucked whenever you're feeding them. Thicken liquids at all times, no straws, right? Mechanically soft or pureed diets, that's more appropriate for them. So those are the things you got to study up on this. All right, blood transfusions. Now in the state of California, LVNs are now allowed to administer blood transfusions. So you have to know the rules included in this. Even if you were in a facility that this still didn't allow you to do blood transfusions, you as a licensed individual can now witness. So you have to know the steps of what you're witnessing to, all right? So I have a slide here that highlights the steps of your blood administration. Now, some key things you need to note. You need 2 licensed individuals. What do I mean by license? Don't get tricked when your NCLEX starts asking you, oh, can a CNA witness? Can an NA witness? No, it has to be licensed, meaning LVN, RN, right? LVN, RN, licensed individuals. Now, when it comes to administering this, so you follow a step-by-step protocol. Once you receive the blood on your hand, you have 30 minutes to administer it. From that 30 minutes forward,